Good morning. I want to welcome you to our press briefing with updates on COVID-19. Please join me in a moment of silence for the lives we've lost and for the families they leave behind. Thank you. Now we'll hear updates from our community leaders. And first up, I'll mention that the mayor could not be with us today. He does send his regrets, and we'll look forward to seeing you again in 2 weeks. The chairman is out today as well, and standing in for the chairman today, we have the public information officer standing in for the chairman today, so we're in good shape. And we'd like to bring up Wendy Howell for a report on behalf of Chairman Cohilas. Pause just a moment, please.
Okay, good morning, everyone. So I want to start out by going over our latest percentages of positive cases of COVID-19 in Dougherty County. We're still hovering around 3%, which is a really good thing. We're hoping to see these numbers continue to decline in the number of positives, especially as more citizens receive the vaccination. So moving on to the vaccinations. Just want to remind everyone of our vaccination sites. Department of Health administering Moderna and Johnson & Johnson, as well as Albany area primary health care. We also understand there are several pharmacies in the area administering the vaccination, so we urge you to check the Department of Health website and you can find that vaccination locator. For those of you who received the vaccine at the former GEMA Mass site, you can contact Phoebe to schedule your second vaccination. We have a slide here from Phoebe about that. There are plenty of available appointments. They have ample vaccine supply and ability to handle the increased volume. It's a quick and easy process, and we encourage you to reach out to Phoebe. 312-1919 is the number. Finally, we just want to continue to remind our citizens to continue to mask up and social distance, sanitize, and do all the precautionary things that we need to do to be safe. See the slide here from the CDC, just some benefits of wearing our mask. Social distancing, things that increase and decrease the risk. And I will tell you in Dougherty County that we will continue to ask you to mask up as you enter our buildings and facilities. Even though the statewide restrictions have been lifted somewhat, we will continue to ask you to mask up to keep everyone safe. So thank you everyone for your diligence. Keep up the good work and be safe. Thank you.
As I said, we were in good shape, and we'll get some good information today. Thank you, Ms. Howell, for standing in for the chairman today. We'll now move to hear an update from Phoebe Putney Memorial Hospital. We have joining us today Dr. Deanna Grant, who is the Chief Medical Officer for Phoebe Health System. Dr. Grant, just a moment here. Let's bring you right up.
Practicing safe precautions. Good morning. I bring you greetings from the Phoebe Putney Health Systems. As of this morning, I want to share with you at our hospital here in Albany, we only have 20 patients. This is probably one of the very low points in the pandemic for the hospital, having 20 patients. However, I stand here as the scientist, still cautious, because in the last couple of days, those admissions have increased. I worry about that variance as well, and I worry about us not continuing to practice our safe protocols. So the virus still is in our community and can be transmitted. The main point we need to understand is that going forward and in this pandemic, how important that our vaccinations are. And here, standing before you today, the message I continue to carry is carry one with you to get vaccinated. Let's go together, not singly. Vaccination. We're not there yet, so continue to roll up your sleeve. There are no excuses now. The vaccine is available to everyone in Georgia who is now 16 or older. The vaccine is at no cost to you at all. We know it's safe and effective, and we know the sooner we get most people vaccinated, the closest we can come back to what will probably be our new normal going forward. People keep asking me about something called herd immunity. When are we going to get there, Dr. Grant? Well, I can't tell you exactly. And then the epidemiologists and the other scientists. However, we know our chances for getting there and getting there to our new normalcy is with this vaccine. As already told you, there are many areas here in Dougherty County that we have the vaccine available. I'm proud to say that Phoebe, from day one, has been in partnership with all the healthcare providers, even private docs here, who signed up to receive the vaccine. Very much so a partnership with the Department of Public Health, Albany area primary care, in making sure the vaccines are available in our communities. We're coordinating efforts to have pop-up events on the weekends. If we're not there, another agency will be there to provide that for you. Again, going to your governmental website to find the different places and the availability of the vaccine. And I'm going to say this several times while standing here. 312-1919 is our hotline to call. We will help you make those appointments on the phone. We all know technology is available as well, but the good old phone and calling us to get your appointment is there for you. I do want to give you some other stats this morning that I want you to be proud of being in this county. Take Dougherty County as example. We are above the state average in the percentage of residents who are fully vaccinated. 18% for this county, and statewide we're at 15%. So take a moment to pat yourselves on the back. But however, we are below the average for the individuals getting that first shot. Only 24% of people in Dougherty County have gotten at least one shot. We want that to increase. 3/4 still need to get the shot in our region for us to be effective. We are convinced if you take someone with you and go together to get the shot, by summer we should be at a stage that whoever is standing before you here, we can now say they're one admission to the hospital and not 20. With that in place, I encourage all, and you see the slide here. We try each week to give you these slides to show you. It seems like that third surge, and you can see it coming down. But what I'm most proud of, that total number vaccinated, 45,000 folks in our county or in Southwest Georgia. You too see our percentage of outpatient. We follow that based on our outpatient center, and we are at 5%. And that's compared to what was just presented to you for the overall county area. And because I'm representing the system as well, I'm showing you Albany itself, but Sumter. I can say as of the last 4 days, Sumter has had no admissions for COVID-19. You want to go to the next slide? And our final slide here is, again, you see the total vaccination, the first and second doses, and that 45,000 is combined. You can see our employees and medical staff, our community health workers, and that 65 and above community vaccinated. Impressive, that 37,000. We set out, and I know both Dr. Hudson and Dr. Black has been before you. We set out when the 65 and above became available. We looked at the census tract, and we thought that we were shooting for 15,000. And look, thank you, the community of Southwest Georgia, are rising to the cause of this pandemic. And you can also see where we gave those vaccines in those slides, and also the ethnicity of the distribution, the age range, and the county of residence for those who have received the vaccine. If you have any questions around the vaccine, we continue to encourage you to call that number, 229-312-1919. We stand to answer those questions, and we stand to provide the vaccine for the members of Southwest Georgia. Thank you.
Thank you very much, Dr. Grant, for your presentation today. It's a pleasure to have you with us today. We will bring up now and get a report from the Department of Public Health, and we have with us, of course, the Director of the Southwest Georgia Public Health District, Dr. Charles Ruiz.
The Southwest Georgia Public Health District is administering vaccines Monday through Friday, and on many occasions on the weekend as well for special events. Since December, the Southwest Georgia Public Health District has administered over 54,000 COVID vaccines. In Dougherty County, we have administered over 8,600 vaccines. This is a good start, but we hope to do much more. And we are available, and the vaccines are available. We can get this done if we work together. And it's very important that we do that. And I have some numbers that I think support the need. Unfortunately, the numbers of new cases in Dougherty County have gone up when compared to 1 week ago. When we look at the number of new cases over the past 14 days and extrapolate that to a population of 100,000, that number has gone from 53 up to 76. That's an increase of 40% in just 1 week. So make no mistake about it, the COVID-19 virus is still in the community, and it is still dangerous. People are still getting sick. People are still getting hospitalized. And throughout Georgia and the nation, people are still dying from COVID-19 infections. It's great that more and more people are becoming immune with each passing day, but many people are still in danger. And we worry that maybe people don't understand the degree of danger that they're in. Many people are, figuratively speaking, walking on thin ice. COVID infections are in their future. And if they choose today to make an appointment to get a vaccine, there's a good chance that they will be protected. Vaccines in Southwest Georgia are plentiful. Appointments are plentiful, and they're easy to make. You've already heard and seen how there are many opportunities to get a vaccine in many different places. I'm probably doing something wrong with our slides. Okay, I think I just saw one. Okay, maybe not. So I do want to stress a few points about the vaccine. It is safe and it is effective. It's good to remember that scientists had a significant head start in developing these vaccines. Typically, we will see that when a vaccine is developed, it'll take years to get it to market. Well, in this case, the technology for this type of vaccine has been studied and implemented for several years now, and it just happened to be good timing that we needed something like this messenger RNA vaccine, for instance. Another thing is that resources that are attributed to the development of vaccines is limited throughout the nation and worldwide. But because of the devastation of COVID, many resources were mobilized and directed toward a quick development of these vaccines. So we had many more resources, many more people, much more money that was dedicated to the rapid development of these vaccines. Testing was thorough and it was successful. It showed safety and it showed that the vaccines were effective. It's very important to remember that there is no virus in this vaccine. In years past, there were a lot of vaccines that contained certain limited amounts of live vaccine, but there's no virus in this COVID-19 vaccine. The side effects that are experienced are usually mild and gone within 48 hours. Many people have nothing more than just a little bit of soreness in their arm at the injection site. It is true that some people will experience varying degrees of body aches and fever, but when compared to the devastation of getting the infection, those side effects are really pretty trivial. I personally have had the Moderna vaccine, and I did experience some side effects after the second shot. I did not enjoy the side effects, but to me, it was a sign that my body was reacting and developing immunity, and I would gladly go through that same amount of side effect again if I needed to be immunized against the COVID-19 virus. One way to schedule an appointment for a COVID vaccine through public health is to simply call your health department. And that number in Daugherty County is 229-638-6424. That's the Daugherty County Health Department number. They are there 5 days a week and they will make an appointment for you. And we have a call center that's open from 8 a.m. to 4 p.m. and that number is 229-352-6567, and that will work for our entire district. Anyone who wants to get a COVID vaccine in any of our 14 counties in southwest Georgia can call this number, and you can schedule it in any of those 14 counties. Again, that's 229-352-6567. And then you can also schedule an appointment in any of our 14 counties by going online. You can do this 24 hours a day, 7 days a week. And the best way to get to this location, I believe, is to go to southwestgeorgiapublichealth.org. That will take you to our district webpage, and on the very first page of that site, you'll see a button that you can click to register yourself for a vaccine. And it's easy to do, it's quick to do, and you can see the locations that we have in the 14 counties, and you can pick a time that works best for you. So one more thing I want to mention is that we are excited that this coming week, starting Monday of next week, we will be hosting a small team of scientists and other workers from the CDC. They are interested in coming here to Dougherty County to visit for a few days to try to learn more about why we are experiencing reluctance toward the vaccine in our community. And it's not just in Dougherty County, it's really nationwide. But we are particularly concerned about Dougherty County because Dougherty County was hit so hard early in the pandemic. They will be here next week. They will be talking to many of the community leaders. They will be talking to some individuals. And again, they're here to learn more about reluctance toward the vaccine. And at the conclusion of their time, they may have some very helpful suggestions to make so that we can try to persuade our friends and neighbors that this vaccine is a good thing, it's effective, it's safe, and if we ever do want to get back towards some degree of normality, the vaccine is going to be the key. We thank you for your participation, and we hope everyone will stay safe, and that includes wearing masks, social distancing, keeping your hands clean, and by all means, if you have symptoms that are consistent with COVID, please stay home, consult your medical provider, and get a test. Thank you very much.
Dr. Ruiz, thank you for your report today. Sorry we did not have the slide you were looking for, but some great information today. Thank you very much for that. We'd like to hear now from the Dougherty County Coroner, Mr. Michael Fowler, for some remarks, please.
I'd like to start off saying, to God be the glory. To God be the glory. To God be the glory. Many individuals praying last year for an answer. Many people was dying, many people been in the hospital, many families lost a lot of individuals. Many people was off jobs, they lost time on your job. We were praying and asking God to give us an answer. And I was reading the scripture this morning. God will supply all your needs. We was praying for an answer. God gave us our answer. I was also praying for an answer. God stopped the death. In the last 3 weeks, we have not had a death related to COVID-19 residents here in Dougherty County. That's why I said I got to give God the glory, because the number was high at one time. One death is definitely too many. When God supply all your needs, when you ask and pray, many people was on the government steps. They was in the home. Kids start praying because they wanted to get out of their house. So many people was praying. God have given us an answer. He gave us the vaccine. God gave us the answer why we won't take the vaccine now. So many people will not take it because they're afraid. I heard somebody say, stop worrying if you're going to pray. If you're praying, stop worrying. Stop worrying about it. But God has given us an answer. So if you're going to pray, don't worry. If you're going to worry, don't pray. Because it's so important. Don't ask God for something you really don't want. God gave us the answer. So the vaccine is here. I would encourage many, especially our community, the Afro-American community. We've been affected for a death rate higher than in other races. You need to consider it. Even talk to your medical professional if you need to do that. But we need to think about that when we ask God for something. He gave us the answer. He gave us the answer. He stopped death for the last 3 weeks. He gave us a vaccine. The vaccine, him, they said they have plenty of vaccine. Only thing to do is make the appointment. I've had the vaccine, and I think most of everyone in here have had the vaccine. We're still alive. Because you have a little symptom, maybe after, you might run a little temperature, maybe you might feel a little sluggish for a couple of hours. But my life, I still have my life. And I thank God for that. And I also wanted to piggyback on the ones that have lost someone. Don't forget, the COVID-19 Funeral Assistance Program start Monday, April the 12th, that you can call the number 844-684-6333. and they will refund the money to you that you paid for funerals. And it's a whole breakdown. You can go down and explain what you need. COVID-19 on the death certificate have proof that your loved one had had COVID-19 or had symptoms of the virus. That would reimburse you up to $9,000. If you have numerous of family members that was in the household that have died from the virus, they'll reimburse up to $35,500. So that is another avenue. God have given you another answer. God have answered it 3 different ways. He stopped the death. He gave us a vaccine. Now he gave us funds to help reimburse the families that have been affected by this virus. Again, the last 3 weeks, 0 death. Thank God.
Thank you, Mr. Fowler, for your report today. We will pause now for some questions from the media, if any. There, we'll check with Ms. Howell as well from social media. Okay. We'll ask that you join us for our next press briefing, which will be in 2 weeks. We'll be back on Friday, April 23rd at 10 a.m.